The alarming reality is that drugs are easily available to children, adolescents, and young adults. As parents, you can have a significant impact on your child's decision to abstain from using alcohol and other drugs. Early, frequent, and thoughtful discussions with your children are key to setting the stage for prevention of substance abuse. In this video, we'll talk about how to communicate constructively about substance use with your family. It all starts with alignment between you and your parenting partner on rules and expectations of your children on this topic. Before sharing those expectations with the entire family, you should ask yourself a series of important questions. What is your expectation of your child with regard to any activity that could potentially be harmful, risky, or addictive? Whether it's tobacco, alcohol, cannabis, gambling, or any other addictive behavior. How do you feel about your child using different substances, including those ranging from vaping nicotine to prescribed medication to illicit street drugs? Would you allow your child to use any substance once they are of a certain age? And if so, how much is too much? What would you do if you found out that your child were using alcohol, smoking, or doing drugs in your household? It's important to remember that your values or wishes for your child may not match your own personal experience. That's quite common, and it's okay. For example, even if you experimented with drugs as a teenager or as a young person, it's critically important to tell your child that such behavior is not permitted in your family. Now, share your responses to these questions with your spouse or parenting partner. Use this as an opportunity to get aligned on the rules and expectations for your family. Even if you're no longer in a formal relationship with your child's mother or father, a doctor, counselor, or therapist can help you come to an agreement so you can present a unified front to your children. By communicating the same message, your child will understand with more clarity what behavior is acceptable to you. Even when kids disagree with you or test your limitations, they will know that these healthy boundaries exist and will understand what to expect when they cross them or violate them. Here's another important insight. Don't try to be your kid's best friend. Be their parent. Kids need rules, boundaries, and support to thrive. Consistency and follow through with your boundaries are the keys to setting your expected standards of behavior with your child. They will also set you up to maintain your expectations. You also need to model the behavior you expect. For example, you might abstain from using alcohol or other substances in front of your children. You might want to attend therapy on your own to work on your issues. You might practice acknowledging the things that you like to improve about your own habits and holding yourself accountable. It's important to note that problems are likely to start when parents are not aligned in their belief systems. Most frequently, this misalignment will send mixed messages to their child. The boundaries become unclear, and the child may turn to the more permissive parent. This can increase the likelihood of drug use. It can also stress the partnership and relationship in the family. Parental alignment about expectations you have regarding your child's substance use will allow you to respond productively if and when the issue arises. Ultimately, no one can single-handedly prevent substance use disorder, but setting clear expectations and consistently working on parental alignment are some of the best tools available to help children avoid unhealthy and risky substance use.